Hey everyone! Ever wondered how a tiny tablet knows what to do once it's in your body? Or why coffee suddenly kicks your brain into gear? The answer is in pharmacology, the science of drugs. Here is what we will cover in this video. At the end we will take a short quiz, so stick around. So what is pharmacology? It is the scientific study of drugs, their sources, chemical properties, how they produce effects in the body, and how the body handles them. It revolves around two central ideas. 1. Pharmacodynamics. What the drug does to the body. And 2. Pharmacokinetics. What the body does to the drug. Pharmacology is a wide field, but here are the core branches. Pharmacodynamics. It studies mechanisms of drug action and the relationship between drug concentration and effect. Pharmacokinetics. It studies the movement of drugs through the body, absorption, distribution, metabolism, and excretion. Pharmacotherapeutics. It focuses on the clinical use of drugs to prevent and treat disease. Toxicology. It examines harmful effects of drugs, poisons, and overdoses. Clinical pharmacology. Applies pharmacology directly to patient care. Pharmacodynamics. Pharmacodynamics is the study of how drugs act on biological systems. Most drugs work by binding to receptors, like a key fitting into a lock. Once inside, they either activate the receptor, we call them agonists, or block it so nothing happens, these ones are called antagonists. For example, salbutamol is a beta-2 receptor agonist that dilates airways, while propranolol is a beta blocker, an antagonist that reduces heart rate. The second is pharmacokinetics. It explains the journey of a drug through the body in 4 steps, often remembered as ADME. Absorption. How the drug enters the bloodstream. Distribution. How it spreads throughout body tissues. Metabolism. How the body chemically modifies the drug, usually in the liver. And excretion. How the drug and its metabolites leave the body, often through the kidneys. For example, paracetamol is absorbed from the gut, metabolized in the liver, and excreted in urine. Here are essential key terms you'll keep encountering in pharmacology. Drug. Any chemical substance that alters biological function when introduced into a living organism. Pharmacodynamics. The study of the effects of drugs in the body. Pharmacokinetics. The study of the absorption, distribution, metabolism, and excretion of drugs. In essence, how the body affects the drug. Bioavailability. The fraction of an administered drug dose that reaches systemic circulation unchanged. Half-life, T-half. The time required for the plasma concentration of a drug to decrease by 50%. Therapeutic index, TI. The ratio between the toxic dose and the effective dose of a drug, representing its margin of safety. First-pass metabolism. When a drug taken orally is absorbed in the gut, it first travels to the liver via the portal circulation, where some of it is metabolized before reaching systemic circulation. This reduces bioavailability. Example, nitroglycerine is given sublingually to bypass first-pass metabolism. So you might be wondering, why is this course important? Pharmacology is essential because it helps us understand how drugs prevent or cure disease. Predict and manage side effects. Use medications rationally and safely. Develop new therapies. So pharmacology isn't just theory. It's the bridge between science and medicine. It guides doctors, pharmacists, and nurses to choose the right drug, right dose, right patient, right time. Without it, medicine would just be guesswork. Now the quiz. Question 1. Which of the following processes are studied under pharmacodynamics? A. Receptor binding and signal transduction. B. Absorption, distribution, metabolism, and excretion. C. Genetic variation in drug response. D. Development of new drugs in the lab. Question 2. Pharmacogenomics is concerned with A. How drugs cause mutations in DNA. B. The role of genetics in influencing drug response. C. The discovery of antibiotics from microorganisms. D. The use of drugs in pregnancy. Drop your answers in the comment. This is just the start. In upcoming videos we'll go deeper into each topic with examples, simple analogies, and case studies. Remember to hit that like button, share with your classmates, and subscribe for more student-friendly medical content. Thanks for watching. Until next time,